Today's checklist is sponsored by United Healthcare Medicare plans. Reliable Medicare coverage for your whole life ahead.
We are back now with an important today's checklist. As we just heard in Hoda's story in our interview with Jenna Fisher, as we're nearing the end of the year, doctor's visits, the annual visits, so important. But there are also ways to track our health at home as well. And here to talk about that, Dr. Ven Gupta, pulmonologist and NBC News medical contributor. Doc, good to see you again.
Great to see you.
All right, so before we go into what you need to look at, why is this so important? I mean, we kind of have an idea, but I mean, there's some things we don't even think about.
Well, Al, I can't tell how many people I know who embrace a tough it out mentality. They have some aches, some pains. They just don't want to see their doc. Yeah. 100 million adult Americans across the country have access to health care benefits. They don't have a primary care provider. Wow. So there's a lot of people out there, unfortunately, that just don't seek medical attention when they should. I'm sure you know some folks in your family. Yeah. And the problem here is if you're asymptomatic, you still might have something to worry about.
All right, so let's get started. One of the things that we take for granted, but can also kind of give you an idea of what's going on is your sleep.
Yep, absolutely. And so, some of the questions you want to ask is, have you heard from, say, your partner that you're a snorer?
Yeah.
Or how do you feel in the morning? Are you fatigued? And these are questions that we don't ask ourselves enough of. Do a sleep audit. And so everybody out there needs to be doing a sleep audit. How do you feel in the morning? Do you hear that you're a snorer? And why does that matter? Right now we recognize that sleep apnea is a condition that can predispose to snoring, but also can predispose you to be actually quite fatigued in the morning. The other thing is iron deficiency anemia. A lot of people just don't have enough iron stores. And we're recognizing now 1 in 3 adult Americans actually might be iron deficient. So those are the two things I would keep an eye out on.
So what about coffee?
Yeah, well, if you're needing a lot of coffee to function in the morning, say, how many cups do you drink in the morning?
I have 1 cup of cold brew.
So 1 cup, that's what we want. But a lot of people are having 3, 4, 5. If you're having to escalate that, you're developing caffeine tolerance. That's something you want to keep an eye out on.
And if you need to nap a lot during the day?
And if you have to nap a lot, that's the big concern here. A lot of napping, a lot of fatigue. That's when you want to ask these questions. Is your sleep good, or do you have low iron?
Okay.
All right, so besides energy level, what are some things you should take note of when you wake up in the morning?
Yeah, one of the things, Dylan, we don't talk enough about is low back pain. I don't know how you wake up in the morning. When I wake up in the morning, I have a 2-year-old and a 7-year-old. One's on my back, the other one's on the other side.
So that is normal.
Exactly. That actually injures the back. It's the leading cause.
That's why my back hurts.
That's exactly. And so that's the leading cause of disability across the world.
Wow.
And so that's one thing you want to ask is, hey, are you actually sore in the morning? Are you feeling immobile? Do you have some muscle stiffness? And that's why we actually have these guys here, the foam roller, the tennis ball. You were actually telling me that you use a foam roller.
I take a baseball and I lay on it and I stick it in my back and I just lay on it just to get into that spot that's sore.
Yeah,
same idea here.
Same idea here. So if you have that point tenderness to what you're, that's where a tennis ball can be really good. It's myofascial release. It's actually opening up that muscle tension. It's releasing it, making you feel better. If if you're somebody that's new to foam rolling or to the tennis ball, start with a foam roller.
Okay.
That's where if you have broad stiffness, not point tenderness, it can actually be a little easier on the body. Other things to consider, though, are dry eyes. I don't know how many of you complain of dry eyes or feel dry eyes. Common complication of Lasix. Medications can cause it, like blood pressure medication. So these are something to keep in mind of. Talk to your doctor about dry eyes.
Okay. Exercise obviously is important, but you say really make note of how you're feeling while you exercise.
Absolutely. So are you meeting your fitness goals? And what are your fitness goals? Is it the 6-minute mile, 7-minute mile? Is it more step counts? How are you feeling during the workout? One thing I would recommend everybody to do is, if you have a fitness tracker, actually utilize the data. Look at your heart rate. If your resting heart rate's climbing up, that could be a sign that perhaps deconditioning is setting in. If you're not able to hit your fitness goals, ask the question why that is the case. And there's potentially medical reasons why, but deconditioning could be one reason.
Okay.
All right. We should also be paying attention to what we're eating and drinking.
That's
that
right.
can help us out in the in-between times. Maybe not all the best news when it comes to drinking, right?
That's right. Exactly. And so, one thing we have to keep in mind of, Savannah, how many times do we have to be told that fruits and vegetables are good for us?
Right. The Mediterranean diet.
The Mediterranean diet. How often do you subscribe to that?
I know. Well, not enough.
No. Okay. Well, so green leafy vegetables.
I'm asking the question.
So there you go. Here's the thing to keep in mind here is just because you can fit a lot of wine into your wine glass, that doesn't make it one glass of wine.
Right.
So you want to make sure that you're actually putting the wine. You know, it's something. I used to be a waiter.
What a buzzkill you are.
I used to be. Well, this is going back to my waitering days back in college. But you want to make sure that wine actually goes to the full curvature, the widest point of that wine glass, and then you want to stop.
Oh.
And what I've noticed is a lot of folks
On
actually
some
go.
glasses, that's quite low, though.
That's quite 100%.
The bottle's almost empty. May as well just top that off.
But that's important because 1 to 2 drinks for men, but 1 drink for women. You want to keep to that. The MIND diet. Here's my advice on that. Make sure you keep a diary. A lot of people think that they're eating well. Do a diary for about a week. See what you're eating and see where there's gaps because you'll be surprised.
Wow.
This is tough to do. Thank you so much.
Thank you.
Thank you. Good info.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.